Hello, and welcome to the research presentation on the patient walker application and then the human subject tests with that assistive robot. My name is Luke Fina and I will be presenting today. The main things we'll be going over are the developed algorithm, the patient walker hardware, the parameter analysis, and the human test subjects and their results. To begin with, the whole point of this is that there's a need to design a robotic platform to help registered nurses, especially in healthcare facilities, to do low-level tasks that all the registered nurses can't necessarily do due to the manpower that would be necessary for it. This robotic platform automation is very helpful with patients that would need extra time or a constant attention that could then free up registered nurses to attend to other more complicated tasks. UTARI's role was to determine the requirements for an adaptive robotic nursing assistant. This includes the development of an autonomous navigation algorithm in a cluttered hospital environment, development of human-machine interface between the robot and the patient, and the development of a patient sitter and patient walker. Two of the areas that are not detailed in this paper but were done are the object fetching and the temperature measurement. This research presentation is solely on the patient walker. The robot that was selected is the Personal Robot 2. It's about the size of a person, and as you can see in the image, the setup for the experiment was about the same layout as a real hospital room with a real hospital bed, and the dimensions are about the same, so it leads to a higher level of success. For the walker, it's usually a two-wheel walker, but 4 wheels were added to make it more maneuverable and easier to steer for the robot. The robot also allows it to be stiff enough and stable enough for the patient to use it at all. Without the robot, 4 wheels for a walker would not be stable for use at all. There is also an Android app and tablet that are used to communicate with the robot, and then a PCB pipe that is used for where the robot grips onto the walker itself. The overall experiment is that the robot starts in this position, as you can see right there. The patient gives the commands to go and fetch the walker. The robot goes and fetches the walker, gets it, brings it back, and then the patient starts the walk. There are 4 main algorithms that are used in this research. The 4 are navigation, which is dependent upon the LiDAR, and it constructs a 3D point cloud that then flattens it to a navigation cost map and a 2D occupancy probability grid to navigate. There's also the walker element, where the robot itself will stiffen its arms for stabilizing the walker. There's also the human face detection, which detects if the person is falling or not. If they are rapidly going lower in the image, the algorithm determines that they are falling, so the walker algorithm bit stiffens up the robotic arm and prevents the fall. And then the last algorithm is the motion planning for the arm, which is done in the MoveIt ROS package for all of the arm kinematics and forces for the robot. There was a parameter analysis. with 11 cases to optimize the navigation. The main elements that were analyzed for input were the maximum angular and linear velocity, as well as the forward, sideward, and angular proportional gain. Here are the parameter analysis results, along with the inputs that were described earlier. Also, many different outputs were measured, from maximum force to minimum force to mean and variable forces. In this case, the best parameter set was case 11. Case 11 doesn't have the lowest force for either gripper, so it's not an optimization of force per se, but it's the most stable because the grippers have the contact with the walker without pushing the handle out of the gripper at any time. So it's the most stable for the patient, not necessarily an optimization of least amount of force or anything like that. I'm going to let this video play. It demonstrates this fairly well.
I will get the patient walker. Outcome patient walker. Outcome patient walker.
So that is the demonstration of it. You can't really see the fall detection, but it is present. There were 8 trials, 8 different human subject tests that were done, and all 8 were successful. Some of the main observations from the different test subjects are the following. Some of the main highlights are that the user interface at times in test 1 and 6 was, sorry, not test 1 and 6, the turning in test 1 and 6 was a bit tricky. And then also in a couple of the tests, like test 1, the user interface wasn't necessarily cohesive enough to definitely know if the commands had been done. And then also in test 5, the experiment had to be restarted multiple times due to errors. In conclusion, the patient walker task for assisting patients was implemented. The best parameter set, which was case 11, was selected. Human subject tests were performed with 8 volunteers, and the algorithm succeeded every time. In the future, hardware and software are open to advanced improvements. In conclusion, I would like to thank the University of West Florida, especially the Department of Intelligent Systems and Robotics, and the Seville Research Group for making this possible. I would also like to thank the University of Texas Arlington and their Research Institute for making this whole presentation possible. Thank you so much.